Hey guys, Dr. Rodman with Sports Chiropractic. Today we're going to talk about something that goes very undiagnosed, and it's what we call jammed back. And it's a very easy way to think of it as a jammed back, kind of like Dr. Chris will explain it very well when he tells a patient that you ever had a basketball get passed to you and you just took it right off your finger and you jammed your finger and it really hurt, because when that ball hit your finger, those two bones got close together and got really sore and bruised within the joint. Now the same thing can happen to our spine, and we call that a jammed back for an easy way to understand it. And yes, it can happen from an injury, like a gymnast who lands with a big force and extension. That really can jam the back. Or it can happen to somebody who just sits too much, or just on this planet we have gravity is always pulling down and compressing our spine, so that can also jam our back. And it can be as bad as, sciatic type issues, pain down your leg. That can be from a jammed back. It also can be something that's just a soreness, constant soreness in your lower back. And the great news is it's a non-surgical thing that we can help here. And if you look at the spine here, you can see what we're talking about a little bit better. So here is a facet joint in the spine, and you should see it should have a little bit of a distance. So when that gets jammed, it gets approximated and closer together instead of having that nice separation. Within this joint is something called Sharpie's fibers, that when those get compressed, there's nociceptors in here which are pain sensitive, so that will send a pain signal to this whole area, to the brain, telling it that there's something wrong with this. So what we do in the office is a lot of therapies to open that space up. And some of the therapies that we do here to open the space up are flexion, distraction, and traction. And what that is a table or our hands, and it uses separate and stretch out the joints to increase the space. Also, what we do is traditional chiropractic adjustments, which are really great for opening up that space, increasing the range of motion, and decreasing pain. The last thing that we like to do is muscle therapy, because if you think about it, muscle is attached to the bones, and when a muscle is short and tight, it's going to pull that bone together. That can create a lot of pain. It can create even a stenosis or a narrowing of the hole where the nerve comes out, which can cause sciatic type symptoms and other things like that. So if you're having back pain, you don't have to live with it. There's a lot of non-surgical options that we provide here at Sports Chiropractic, and we'd love to help you out.